Joining us right now is Dr. Sheila Dean. She is a registered dietitian. So what do you think about this whole business with statins? Good or bad?
Well, I think statins have their place. I think that first-line therapy should always be good nutrition and exercise. And if that doesn't work, then consulting your primary care physician regarding the use of a statin might be in order.
Okay, so give me just something I can remember and cling on to as far as food, natural nutrition. What can I do that could help at least stabilize or lower my cholesterol?
Well, keep in mind that lowering cholesterol in the diet doesn't actually lower cholesterol in the blood that much. The three things that you really have to do to get cholesterol down is you've got to reduce your calories, you've got to lose some body fat, and you've got to exercise. Now, more specifically, if you make sure that you're eating a diet that's high in fiber, especially soluble fiber, which you're going to find in your fresh vegetables and fruit, and I'm not just talking about a small little Caesar salad every day, I'm talking about a significant increase in your fresh vegetables, you just might see a significant drop in your cholesterol.
Now, I know there's always been a little controversy about the connection between cholesterol and heart attacks as well, which we really hadn't heard talked about much until this statin recommendation came out.
That's right. Well, not everybody who has high cholesterol actually goes on to have a heart event, a cardiac event, and not everybody with normal cholesterol never has a heart attack. So I think it's important that a person works with their primary care to individualize the approach.
Now, I'm not have any of the risk factors, but I got on a 5 milligram dosage of a statin because my doctor thought it would be a good idea. My cholesterol went from 238 to 162 in 5 weeks. And I'm telling you, I've been exercising my buns off to try to get it to drop at all. And then all of a sudden with the statins, it dropped.
Absolutely. That's what statins will do. Statins are designed to lower cholesterol, and they'll do it fast. The thing is that statins absolutely do have side effects, and we know that because those were published in some major medical journals a couple of years ago and has been a very controversial area. One of the side effects is that statins can cause type 2 diabetes, so we're going to have to be very judicious about our use of statins.
Okay, what prevents people from eating right? You deal with this every day, and people are stubborn. We get into habits we can't get out of, and we also like to reach for one little pill to solve all of our problems.
Well, I think the number one problem is that if you don't plan, you're going to plan to fail. In other words, it's really important that you take some time, just a few minutes, and even if it just means 5 minutes the night before, to think about what your next day's schedule looks like, and then plan ahead of time so that you don't just sort of fall into your natural habit, as you were saying. Wow,
that would be great. Dr. Sheila Dean, great information, great suggestions for us to live healthier, and if your doctor tells you to take a statin, you should, right?
If your doctor tells you to take a statin, you should, but you should definitely talk about your options with him or her as well.
All right, doctor, thank you so much. Good talking to you.
Thank you.